Good evening, you are tuning in to AWANI Tonight with me, Farhana Sheikh. Malaysia recorded the highest number of daily COVID-19 cases in a single day, and contract doctors to get 2-year extension and paid study leave, says Prime Minister. That's coming up. Malaysia recorded the highest number of COVID-19 cases detected in a single day, with 15,573 new infections, with 6 in 10 cases in Klang Valley alone. This is also the first time the country has breached the 15,000 mark for new daily cases. Selangor again topped the list, contributing to almost half of today's infection, with 7,672 new cases. This is followed by 2,063 cases in Kuala Lumpur. The situation is also worsening in Kedah, with 937 new cases over the last 24 hours. Meanwhile, 144 deaths related to COVID-19 were recorded today. Minister in charge of vaccination, Khairi Jamaluddin, has instructed all vaccine administration centres to allow recipients to record themselves when they receive their vaccine. Khairi also reminded all vaccinators to show recipients their syringes before and after jabs as per SOPs. This, he said, was to dispel doubts about improperly administered vaccinations following claims about blank COVID-19 vaccine shots being administered. Khairi also dispelled links between alleged blank vaccine shots and illegal vaccine sales, saying there has been no evidence to suggest a link. Pharmaniaga is allowed to sell its Sinovac vaccine in the open market, as it has already fulfilled its commitment to supply a 12 million dose order to the government. He added that the ceiling price and sales guidelines for the Sinovac vaccine have been set, and that JKJAV would meet next week and discuss the matter further. Pharmaniaga plans to sell 14 million doses of the vaccine to the private sector starting August. Khairi said this would help get more people vaccinated quicker. Some 71.9% of the adult population aged 18 and above in Selangor, Kuala Lumpur and Putrajaya have received their first dose of the COVID-19 vaccine as of yesterday. According to Khairi, this was in line with the Operation Surge capacity, which targeted injections of 211,000 to 275,000 doses daily for residents in the Klang Valley since last July 21st. The target is to give at least 1 dose to all adults in the Klang Valley by August 1st. Khairi also assures all school staff will be vaccinated against COVID-19 by the time schools reopen on September 1st.
I think we are close to vaccinating all the teachers, but we're working closely with the Ministry of Education to ensure not just the teachers, but the support staff also. Those working at the schools, cleaners, canteen operators, security guards, as well as the bus drivers. So we're working very hard to ensure that the school environment will be safe once we open the schools.
The government has agreed for medical, dental and pharmacy officers with contract appointments to be offered a 2-year contract of service upon completion of their compulsory service period. Prime Minister Tan Sri Muhyiddin Yassin said the move was to ensure continuity of service and also as a preparation for the young doctors to pursue specialist training. In a statement released today, he said this was among the immediate solutions approved by the government after the proposal relating to the improvement of contract status for health workers was tabled by the Ministry of Health at a cabinet meeting on July 14th. According to him, the government fully understands the demands of this group of contract health workers and is also aware that their contributions are crucial in providing the best health services to the people, especially during this COVID-19 pandemic. The Prime Minister said the Cabinet also agreed to extend the contract of service to a maximum of 4 years for medical and dental officers accepted to pursue specialist training during their first 2-year contract. The government urged those who conduct COVID-19 home self-assessments to report their statuses regardless of their results. Health Minister Datuk Seri Dr. Adam Baber said all results of the home test kits, whether positive, negative or invalid, must be reported on the My Sejahtera application. He also advised people to only purchase test kits approved by the Medical Devices Authority. So far, 3 COVID home test kits have been approved for the public, namely the Selexium Rapid Antigen Test by Razon Diagnostic International, GMAID COVID-19 Antigen Saliva for Home Use by Philosys from South Korea, and the B-Rite COVID-19 antigen rapid test device by Hangzhou All-Test Biotech. Dr. Adam added that those who are symptomatic despite testing negative are advised to get themselves reassessed at government health clinics or private clinics. The government has started its plan towards separating the roles of the Attorney General and Public Prosecutor. The Minister in the Prime Minister's Department in charge of Parliament and Law, Datuk Seri Taqiyuddin Hassan, said the federal government is always open and ready to take measures to preserve public integrity and trust in the legislature, including the Attorney General chambers.
In a statement, he added that the plans will be improved through comparative studies with other countries while considering the suitability of the country's legal system. He also said that the government has no objection in considering the setting up of a Royal Commission of Inquiry, or RCI, should it be needed to reform the institution.
We'll take a short break. Stay with us. Welcome back. The COVID-19 pandemic has for now knocked the conversation on climate change onto the back burner. But the massive disposal of single-use plastics for clinical waste and personal protection gears like masks and face shields will soon come to haunt us. Zero Waste's Jasril Lim urges Malaysians to practice proper waste management to reduce the impact on the climate.
Since pandemic, the usage of plastic waste have increased tremendously. So for clinical waste, according to the style, the amount of clinical waste that we are producing actually doubled compared to pre-pandemic to the level of waste that we are generating now. Yep. So it used to be about 2,000 tons per month before pandemic, and now we are creating about 4,000 tons on a monthly basis this year. Yep. And this just show how much clinical waste that we have created. And this number itself does not even include masks. Yeah. So the mask that we use outside of the healthcare treatment is not in this number, which is pretty scary.
She added that overloaded landfills and dumping sites will become a costly issue in the future.
It's taxpayers' money that we pay to city council, town council that help us to manage our waste. So for them, they would actually need to fork out more money to manage our waste, collect our trash, and even more resources, to help the whole waste system to move smoothly.
Jasril urged Malaysians to try to reduce plastics consumption and practice better waste management.
Do educate people around you, share online, share with your friends and family on how everybody can just do something and also to contribute this to our environment, also waste issue. Yeah. But of course, the best part is if you can read out more about this, like read out documentary, share your learnings online, even create content just to talk about this environment, waste and pollution issue in Malaysia.
On to the international front, the Philippines is banning travellers from Malaysia and Thailand as Manila faced tighter restrictions to curb the spread of the Delta variant. Presidential spokesperson Harry Rocker said today that the travel restrictions is effective from Sunday until the end of July. He said the decision was made to prevent further transmission of new and highly infectious variants in the Philippines. It had previously banned travellers from 8 countries, including Indonesia and India. President Rodrigo Duterte has put Manila, with a population of over 13 million, and 4 provinces under stricter curbs until the end of the month. Only 47 cases of Delta have been found so far, but this variant has already surfaced in Metro Manila, a sprawling, densely populated region of 16 cities. New case rate is back on the rise in the United States as the Delta variant sweeps across the country. The U.S. Centers for Disease Control and Prevention, however, has not revised its masking guidance in response to the outbreaks. The CDC in May relaxed its guidance so that fully vaccinated people do not need to wear masks in most public spaces. CDC Director Rochelle Walensky declined to say if the CDC is considering changing the guidance. The 7-day average of new cases in the United States is up 53% over the previous week, with the Delta variant comprising more than 80% of new cases nationwide. The uptick in cases is concentrated in regions with lower vaccination rates. Florida, Texas and Missouri account for 40% of all new cases nationwide, with around 1 in 5 of all new US cases occurring in Florida. The CDC as well as Food and Drug Administration are also reviewing data to see if there is waning immunity in vaccinated people to determine if additional booster shots are needed. At least 36 people have died and dozens are feared trapped in the western Indian state of Maharashtra after torrential rains caused landslides and flooding, submerging low-lying areas. Hundreds of villages were also left without electricity and drinking waters as rescue operations are ongoing. Rivers in Maharashtra were flooded after authorities released water from dams made full after many parts on the west coast received more than 8 inches of rain in 24 hours. At least 4 people died after a building collapsed in the financial capital Mumbai and another 14 were killed in 4 landslides in other parts of Maharashtra. Disasters caused by landslides and flooding are common in India during the monsoon season from June to September, when heavy rains weaken the foundations of structures that are often poorly built. But the monsoon also delivers more than 70% of India's rainfall and are crucial for farmers. After a year-long delay, the 2020 Tokyo Olympics formally kicked off tonight. Unlike any games before, which are usually held in a stadium full of ecstatic fans, athletes from across the globe paraded in a near-empty venue tonight. Fewer than 1,000 people were in attendance at the new Tokyo Olympic Stadium due to COVID-19 restrictions. Regardless, it marks a coming together of the world as millions around the globe tune in to watch the start of the greatest show in sport. A countdown kicked off fireworks above the stadium, followed by illuminating performances by dancers. The opening ceremony also recapped Japan's path to the Games and the challenges faced when COVID-19 struck. A moment of silence was called to remember the victims of the pandemic. Japan's Emperor Naruhito declared the opening of the Games, which will run until August 8. About 11,000 athletes from 204 nations are taking part, along a team of refuge athletes competing under the Olympic flag. After months of silence, Parliament is set to come alive, but will we have a substantial or cosmetic sitting of Dewan Rakyat? Tonight on Consider This, we ask our guests how Parliament can begin to function as intended. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Farhana Sheikh. We'll see you again.